For the first time, we're hearing from state health officials about a scathing new audit of the state's Medicaid program. It showed millions of dollars going to healthcare providers that shouldn't have. It even says people's safety was at risk. Our Capitol reporter Michael Hyland is live in Raleigh. Michael, what's being done to fix this?
And that's one of the main things that Dr. Mandy Cohen talked about here with state lawmakers. But leaders of the Department of Health and Human Services say there are no excuses. Millions of dollars in taxpayer money misspent, and now we're hearing from the people responsible for overseeing that.
You have a report as damning as this is, usually people lose their jobs.
The state auditor took a closer look at North Carolina's Medicaid program. It's a $14 billion program providing health care coverage to about 2 million people, largely lower-income families. When it comes to tracking doctors, dentists, and other health care providers, the auditor found the state didn't do enough to check whether those people had lost their licenses or had them suspended. That led to $15 million in improper payments going out. That also meant a higher risk of people who could pose a risk to patient safety being enrolled in Medicaid.
The audit did not find any issues related to the initial applications. The audit was related to our ongoing monitoring.
Dave Richard, who oversees NC Medicaid, says the state's automated system that's supposed to flag these issues failed.
There is absolutely no excuses on our part.
He said that's been fixed, and the agency is making additional technology upgrades. The audit comes as Democrats push to expand Medicaid to cover hundreds of thousands more people. Did you have any concerns about what you read in there?
Yes.
Do you think that should have any bearing on whether the state expands Medicaid?
I had great concerns about it. Those of us who have advocated for it have some hope that we can continue to look at some ways. Maybe it won't look like exactly full Medicaid expansion.
If you can't manage the cases that you have now, that you'd have even more difficulty managing a larger section of the population.
And when it comes to COVID-19, Dr. Cohen said the state's trends are moving in a very positive direction. She pointed out we're only 6 weeks away from when we hit the peak of hospitalizations back in January. But she said Governor Cooper is looking at what restrictions could be loosened. She did not indicate what those will be, but she did say we should expect to hear from the governor about that this week. Live in Raleigh, Michael Hyland, CBS 17 News.